contain your baby. I would rather have a baby who crawled and walked a little bit later than a baby who skipped crawl. I think it's banned in Canada because something I hear is like, my baby's just being lazy, my baby's just being tired.
Hello, everyone. Welcome to Pregnancy's Critical Thinker podcast. My name is Caroline. I'm a long-time postural massage therapist with focus in prenatal and postnatal care. And I started this podcast as a way for my clients, you, and hopefully myself in the future, to learn more about the ways we can support ourselves through pregnancy. Today's episode is a little different. We're going to talk about baby's development, which is going to be very, very beneficial for first-time parents especially. But if you are already a mom, it's going to be very beneficial for you as well, because today's guest is amazing. She's a board-certified, let me not fuck it up, but it's a board-certified Pediatric Clinical Specialist and a founder of Wonder Pediatric PT and Wellness. There we go. I got it. Dr. Amreen, welcome.
Thank you. Thank you so much for having me. I'm so excited to be here.
Me too. So tell me, how's your day going so far?
It's been good. Just had a busy weekend, but it's really nice outside, so the day is going good so far.
That's true. And I forgot to mention, you're also first-time mom. Is that how we say it?
Yeah, I had my baby last year. He just turned 1 like 2 weeks ago.
Oh, happy belated.
Thank you.
It's so cute.
It was really great. I feel like the first year was just a lot. I thought going in, it's going to be a lot easier than I thought it would be, and the first 4 weeks were. But then after, it was just surprising because it's opposite for most parents I talk to.
Yeah.
But then after that, I feel like it was a little bit hard. It was like a roller coaster. Like, we had some really, really good, fun movement and moments, and then some were like very overwhelming.
Do you think it's because you have so much knowledge, you're kind of looking at things a little differently?
I think so. I feel like I was so in tune with like his body and his movement and like his postures. I feel like I was so focused on that. And I had to like take a step back and like look at him like as a whole baby and child, and like learning that he's developing, he needs some time, and like trying to like be more of a mom, less of a therapist.
Yeah, I can see that. Yeah. So why would you say like 4 weeks were like, I guess, easier? You just like, because for most of the parents, it's that switch from like babies being outside of you. Now you have to take care of, like, learn how to approach it. So why do you think like the 4 weeks were a little easier for you than the rest of it?
So for me, I feel like he was very passive the first 4 weeks. It was just eating and sleeping. I feel like most parents sometimes have a hard time like handling just a young baby because they're so little. But I'm so used to like handling them, swaddling them, comforting them. Like, I already knew like when he was fussy, what to do, how to regulate him. Like, let's get on the ball, let's do this. So I feel like that was pretty easy. But after like 4-6 weeks was when he started to go through like a transition where he was more fussy, more alert, had a hard time regulating himself. But that got a little bit harder. But the first 4 weeks was like, we were going on to lunch twice a day, getting coffees. And I was like, this is so nice. This is very easy.
This is great, yeah. Nice. So, there's so many things I want to ask you, because we met up for lunch, just so you know, and we talked about it a little bit, about the work you do. But I don't know, where do you think we should start to kind of get your knowledge out? Like, what? Like, for example, I came into you like new baby. I guess let's start there. Like, how? Like, when should I see you? You told me about it a little bit when we had one-on-one, but maybe just a little bit for the viewers as well.
So I feel like that kind of just depends on the parents, because one thing that I'm very passionate about is wellness when it comes to babies, which it's not a term that's very easy to kind of understand. Like, what is wellness? Why do babies need to see a therapist?
They don't have that much stress as we think. Yeah, you're just born.
You're just born. But their position in the womb, how they were, if there's any oral tension, your birth, all of that can kind of like cause stress to the baby when they kind of come out. So some of the babies that I see are very tense. They have torticollis, like tension in their neck. So I feel like in general, just having a screening with the PT would be helpful. But as a parent, if you want to like learn how you can help you develop your baby, because a lot of first-time parents have knowledge in different areas than I do. So they know how to like, they don't really know like sometimes how to play with their baby, how to do tummy time properly. They are getting more proactive and like learning those things, but someone who can kind of show you like, hey, these stretches would be good. This is what tummy time is supposed to look like. These are the ways you can support your baby's development, but then also bond with your baby. Like, if your baby's really fussy, You can get on the ball. You can rock them. You can baby wear them.
Wait, what does getting on a ball mean?
Oh, sorry.
I'm just like, you said for a second. I'm like, is that like the fitness
The
ball you
birthing,
use?
yeah.
Okay.
I love using that like post birth too, because all of us have it during prenatal
So
time.
you just like get with it on the baby and kind of like rock? Is that?
Yeah, so
okay.
you get on the ball. Baby loves the rocking, swaying motion. So you get on it, you rock. Especially in the evening hours, called like the witching hours, you rock. You can bounce a little bit. You can put your baby on the ball for tummy time.
Oh,
You can sway side to side. So
That's
yeah,
cool.
I
Okay.
really like. It's almost the same thing as the bouncer or the swings that they sell as containers, but it's a little bit more therapeutic because the baby's getting your touch,
With
you're
you, yeah.
co-regulating, you're doing a lot of skin to skin. You can change the rhythm based on how your baby's responding. So we used it a lot up until like 4 months or so.
I think I've
Yeah.
even seen like a reel like referring to that. So that's a very cool tip.
Yeah.
Plus, like I feel like because in Russia they like all the grandmas just like rock and they like walk around the room. I feel like that would be so much easier. Plus, again, like you also helping your body as a new mom, right, to kind of feel what everything feels and stuff like that.
Yeah.
And working on your pelvis. So that's
Yeah.
a great tip. So okay, so learn about the ways you can connect with the baby and the moves you can do. Even if they don't have anything quote unquote wrong with them, right? It's just a good way to see what your baby's about.
See what your baby's about. If there is anything, then this is also a good time to catch it. If your baby is tense, if they are showing a little bit of preference, then you can pick up on those things early and then kind of work on it. Because your provider will screen for those things, but coming from a movement perspective, this is what PTs are specialized in. So if there is something, you'll kind of learn, and then just learn how to like play and engage with your babies better and just have more knowledge. I feel like that's so powerful because like a lot of parents don't have that information, or you find it online on social media, but it's not individualized to your baby
100%.
and to you.
Yeah,
So-
and like, it's also like with the recipes you see online, you see the recipe like, I should make this, and you just never do. So I feel like the same. You see like, oh, that's a great tip for like working with the baby, but you never end up doing it because I mean everyone's busy, obviously.
Yeah.
And the postpartum already pretty overwhelming for the moms itself. But okay, awesome. So it's not usually offered though, right? Through OBGYNs or anything like that. People do not know that they
Yeah. I don't think a lot of people know about it. A lot of people think like, hey, I need to see a physical therapist if there's something wrong with my baby. And working with a lot of moms, I found out that sometimes there is a taboo working with the PT because you feel like there's something has to be like to go see a baby, or my baby's in PT, versus thinking of it like PT is just helping support my baby's development and providing me with tools, which I didn't think of. But one of the parents told me like some parents sometimes feels like, oh, my baby's in PT, so there must be something wrong.
Oh, so it's kind of like getting that like negative connotation to it.
Sometimes, yeah.
Oh,
Because I feel like as PTs, we're not like marketed as well as wellness providers as some of the other providers are. And a lot of it is changing, and I wanted to change for the baby's world as well too. So I think the biggest thing is like you get so much knowledge, so you're not in like, am I doing this? Because Google and TikTok will just spiral you. I've been there. I've done it. You're sleep deprived, and one thing leads to another. So for this way, you're talking to someone who does this all day long. They can help you with that. And I think being a first-time mom, I kind of learned like what is practical, what is not practical. Versus before, I would give my recommendation, but I think experiencing postpartum, breastfeeding, pumping, sleep, and everything, like seeing how passive these babies are like first 4 weeks, knowing like what are some practical tips for parents,
That's really cool. Yeah, I'm actually waiting to be pregnant so I can be a better therapist at my job as well. I'm like, oh, this is actually hurts very badly. I should do something about it.
It's very eye-opening.
When you put like practice on it, you're like, oh yeah, I see things differently now. Okay, so I know with the like human PT, it's usually prescribed, like not human, adult PT.
Yeah.
It's usually prescribed by a doctor. And I think they also see it more as, I guess, something is wrong. I went to the doctor, they said I should do PT, even though I believe PT should be kind of just ongoing thing for you, because you should learn how your body moves, like what is, like which muscle is off, right? Which muscle is tight. It's a great way to kind of get to know your body and tune it. So the same, I guess, for the babies, but baby PT is not usually prescribed, right? It's just like you have to seek it on your own.
From a wellness perspective, if it is like if your baby's falling behind in rolling or crawling, if there is torticollis, then the pediatrician would kind of prescribe it. And then we'll send those patients. Oftentimes, we get those babies kind of late. Some pediatricians are very proactive and will get those babies within like 2 or 3 months of life. But sometimes we get these babies a little bit later than we're supposed to. So sometimes babies will come from a pediatrician if they need something. Some parents, now that there's so much information out there, will pick up, like their friend will tell them, or they'll find it online and they're like, hey, I think my baby does have body tension. I saw a reel about it. Is this what it is? Do you think, can you take a look at it? So we do get few parents who are pretty proactive, which is really cool to see now. But mostly pediatricians are the ones sending clients.
Got it.
Yeah.
Okay. And you're trying to change that so like every parent kind of has at least like one session, maybe in the first 2 months of life? Or
I
what
would say within the first 3 months of life
months of
would be
life.
really helpful. Like ideally around 2 months or so. You also get to like see what your body goes through postpartum. If there are any like difficulties that you know early on, like with breastfeeding or torticollis, then yes, come within like early weeks of life. But if not, that 2 month would be a good point to get checked out, make sure everything is going okay. You can get screening and learn how to like what to do within the next couple of months of life. And then if you found it helpful, then come back again at 6 months and 9 months and 12. Because your babies are developing so much within the first 3 years of life. They're learning new things. So what's relevant at 3 months is not relevant at 6 or 9 months. It does set the foundation, but their brain is developing different. Their cognitive process is different. Just like with those toys are going to be different. So the way I'm going to engage with the baby will be different for a 9 month versus a 3-month-old baby.
Makes sense. Yeah. They are changing a lot.
Exactly. So I would say like within the first year of life, it's just helpful to do that.
And would you say, so usually like the first 3 months, it's usually things that like came from prenatal period and like birth. And then it's more of like how they started engaging with the surrounding.
Yep.
Kinda, or yeah.
Yeah, I think that sounds about right. Like if it's not addressed like within the first 3 months, then it can carry over to later too. So it probably came, if it was torticollis, which was caused by their position in utero, then if you didn't see anyone, you'll still have the symptoms at 9 months, but it was from their positioning in womb. It could be from like any oral tension. If it's twins, it's very common. The twin A is more likely
because they
to
don't have as much space and kind of do
exactly.
Oh.
Breech babies also
breech
pretty
babies, yeah.
common. But yeah, twins, and more likely twin A is going to have any sort of like torticollis or tension in the body because
because
twin B,
they're in the lower in the pelvis.
and the
like
twin
this.
B kind of maybe sits on top of twin A.
Interesting. Oh, so they actually put the weight on it too.
Yeah, like you're kind of crammed on the bottom. Yeah.
Huh. Very cool. And I never even thought about it, about the twins being.
The twins, yeah.
Okay, cool. So tell me, like the first 3 months of life, like what are like the most common things? You said that torticollis, and is tongue tie something you also work with? Because I feel like pretty much all my clients' babies have that for some reason.
Yeah, I don't really know the cost. Like there's so much out there, like referring it to like different genes. But with tongue tie, a lot of time what we want to look at is like, is this functional or not functional? Like you can have a tongue tie, but you can still be very functional with your feeding, with your latching, with your body. But the babies that I see are the ones who are struggling to transfer milk. Either they're not opening their mouth wide for a latch, mom is experiencing pain, they're inefficient with transfer. So when there is a tie, because your tongue forms very early in gestation, forms at 8 weeks. So when there is a tie, 8 weeks of gestation.
That early?
Yeah.
Wow. Yeah.
So you're practicing same swallow stuff in womb. And then when you come out, you're going to practice like breastfeeding or bottle feeding. So, but your tension in your body, kind of your muscles compensate because of that. So if there's a tie, a lot of the time what you'll do is like you'll lift up your shoulders, you'll make your neck low, and you'll be in this position. You'll be really tense, so you can't open your mouth as wide as you need to. Your tongue is not going to elevate to your roof of your mouth or your palate. And then most of the time you're going to have your mouth open. You're not breathing as well through your nose because of that too. And you're just in that state of like this dysregulation, because now we know that when your tongue goes to your palate, it helps stimulate your vagus nerve. It helps calm you down and regulate you. So you're not getting that. And while you're feeding inefficiently. So you're getting a lot of air bubbles, which can lead to like reflux. So then overall, your body's in a more tense, uncomfortable state.
And you're just in a bad mood after that.
Yeah.
I would be too. Yeah.
My little one was. And it impacts everything. Like it impacts sleep. It impacts digestion, play, how they bond with their caregivers too, or their parents, because they're constantly tense. And then to co-regulate is hard too, because you can get overwhelmed as a parent. So so we see those babies too with ties. So the first thing to address, in my opinion, would be like that tension in their mouth, in their body. Once we relieve that layer, it's like an onion, once we peel that layer off, that's when we can see how much the tie is impacting their function. Because right now, there is so much tension in their muscles. There's so much tension in their body. We cannot do strengthening efficiently. So first we release that, help regulate their nervous system, and now we can strengthen their tongue. And if you feel like we've hit a ceiling or like something where we can't go any further, that's when we're like, hey, let's talk to a release provider and see if the release would be helpful. And then let's do therapy post, because now you have the new range. And how can you move your tongue properly? Sometimes I see babies post-release versus pre-release. It's almost like with surgery. You want to do prehab work before.
Whoa. Okay. And then after.
And then
tuning it up.
afterwards.
Wow.
Yeah.
I didn't even think about it.
Yeah.
Wow. Because I feel like, clients who shared their journey with the tongue ties with me, they just like kind of went to someone once and that was fixed, as they said.
Yeah.
But now I'm thinking, was it? Like, or is it like baby actually needs like, kind of like, as you said, after surgery, more tuning, more learning about how to use it properly afterwards.
Because they have this new range that they don't know how to use. The tongue can move all over. And then, so like teaching the tongue the proper mechanics, how to suction, making sure those muscles that are tight are relaxed now too. Because that tightness didn't go away because the release happened.
Yeah.
And then teaching the body to be in a calm, relaxed state so they can feed. They're not going to eat in like a very tense state.
Now you saying all that, and now I'm thinking, because I feel like there are so many adults who are mouth breathers, and we talk about it often with my clients as well. That a lot of people don't keep their tongue kind of at the roof of their mouth. Do you think it could be lingering from that?
It could be, yeah.
For that, their whole life is just like because I see kids sometimes use that, like they breathe through their mouth for some reason. I'm like, could it be from that?
I feel like it could be, and like multiple things. Like I have a tongue tie, and I just recently found out when I got more and more into it. I always thought I had a short tongue and a short neck, but there's so much tension here. Like I can't extend my tongue. Going to the dentist is painful. Opening the mouth wide, and like certain things kind of triggers. I don't mouth breathe to sleep.
Yeah.
So my tongue does go up to the roof, but there's so much tension.
Should I
in
check
my
it?
body.
Wait, how did you find out that you have one?
When I took the courses, I kind of learned what it is, and then I saw it, and it's like my tongue doesn't elevate as much. It doesn't come out. I don't have a lot of tongue mobility. And I think it does impact my function. I do have a lot of tension. I do want to get a release at some point, but I want to make sure I'm ready for the rehab with it.
Yeah.
So I want to make sure I'm seeing a myofunctional therapist or someone afterwards.
Yeah.
To help me versus just getting a release.
Now I really want to check if I have one, because sometimes like I always think it's because of the tight jaw. I get like sensation here, and I'm pretty sure it's like where the tongue attaches is the sensation I have. And I always want to I stick out my tongue very far and kind of like move it around, and I feel release. So, but I thought it's just because I'm bilingual and I can't speak English, so it's like my mouth get tired. But I'm curious, like what if I have one too?
I mean, you can try myofunctional therapy before too, and like work on even with massage, working on like releasing tension within the floor of your mouth, the pterygoids, your buccal, your masseter muscles.
Sounds so good. Yeah.
I know, right? I was like, I think that sounds good to me.
Yeah, like I want to just like relax everything here.
All of this. And then see how much movement your tongue has.
Yeah. But because I bet it also affects like lymph drainage and like, I guess how you use your jaw in general.
Your jaw.
Yeah.
Babies
your
have
infections maybe.
Exactly. Yeah. They have recessed jaw in general.
They have what?
A recessed jaw, so where their jaw is a little bit backwards when they're born.
Oh, really? Mm-hmm. Like the joint is like a little pushed?
Just a little bit backwards, yeah. So as they start to suck, they kind of and they bring their jaw forward, they will bring that lip out, and then it kind of helps protrude it a little bit forward when they're sucking efficiently. So with babies who do have ties, or babies, even if they don't, but if they have like tension in their mouth, you can notice that their lower lip is a little bit backwards.
Interesting. I think it's also like a baby, because obviously they spend more, you need more power, more effort to breastfeed rather than bottle feed. Would that affect like how they protrude their jaw forward or not?
It could, because like muscles are a little bit different with breastfeeding and bottle feeding too. Breastfeeding, you're working a little bit harder, and with bottle, it depends on the nipple size and everything too. I guess not the size, the flow you're getting, and if the feeding is paced or not. But because you have to bring it forward, and then that would allow you to close your lip when you are sleeping. You close your mouth and then get that tongue to come up. But it's also connected in the body because I can close my mouth in this position. But then here my mouth opens and I have to work extra hard to bring that lip forward.
Oh, you like feel the tension, like kind of like not letting you?
Yeah, like so if your mouth is open, when you go down, like when you flex your neck, it'll automatically close.
Okay.
But when you open it, if you look up, your mouth will open. So some of the
I see what you mean. Yeah.
So some of these babies will then compensate and they'll just stay in this state to close their mouth. But they can't close it exactly. They're easier. They can't close it in neutral. And then they're looking up and then their mouth is wide open. So it's like all connected down to their body too.
Wow.
Yeah.
So I guess that could be like also a cue for parents to like see if baby does that, just to know if they
Just to see.
should go see you.
Yeah, look at their posture, see what they're doing. Are they sleeping with their mouth open? Are they snoring? I think one of the biggest thing that comes is like if it's painful, if breastfeeding is painful. So for me personally, my breastfeeding journey was not painful, but my baby had a tongue-tie reflux. But for him, he was snoring, he was mouth breathing, and he was getting in a lot of air while he was breastfeeding. So we did a lot of body work with him too, and we got a release, and then a lot of body work post-release too to kind of help him. So I feel like pain is not always the first thing, but if it is painful, that's the first sign parents know that they need to seek help, which makes sense. Yeah.
Interesting. Very interesting. Okay, amazing. So, okay, so we got that. So torticollis, I guess you said it's a big part of your practice. You said like you have over a decade pretty much of experience with that. Any things that like you kind of pinpoint from that part of your job? Anything parents should know or anything interesting facts, I guess.
Yeah, like I mean, in terms of like, it's very common. We see it all the time. Ideally, like there's a lot of research out. So if you treat it within the first 2 weeks of babies being born, there's so much better recovery and it's short term. Versus like if you treat it later at like 5 months or so, you're going to be in PT for like much longer, like 3-4 months or up. I think another thing that parents don't realize is that torticollis affects their baby's movement and milestones. So babies early on are very visually reliant. Like they look at their vision and that's how they explore their world. If I'm only looking to one side, I'm only going to discover that hand and I only bring that hand to my mouth. So it's creating all these asymmetries early on. So then these babies will only bring one hand. In tummy time, they'll do the same thing. So now I'm weight bearing very asymmetrically. So then I only roll in one direction. When I'm crawling, I might have a hitch crawl. When I pull up to stand, I'll only bring that same leg up. So that asymmetry carries over where one side of the body will always work harder. So you're creating like muscle imbalance in these babies very early on within the first year. And I think that's something that's not very common with a lot of like parents now, because they'll look at the neck. And even when the neck and the tilt is fixed or the baby doesn't show it anymore, that asymmetry will carry over. So like within the first year of life, I tell my parents that you want your babies to be very symmetrical. So watch out for them as they're learning a new movement after they've mastered it. Can they do it on both sides? Or how's their weight shifting? Is it pretty symmetrical? Up until the first year, very symmetrical. So I see parents at like 4 months, they're like, oh yeah, my baby will be left-handed or right-handed, but it's so soon to tell. You don't know till like 18 months of life.
18 months is when you kind of know?
Like, 18 to 2 years is when the dominance really come in.
So what the dominance is more like genetic, you think? Because I know like there was time in Russia where everyone who was born left-handed in Soviet Union, they used to reteach them to be right-handed because that used to be a pathology. Now it's considered like, oh, you're very cool because you're left-handed. Where do you know where it's even coming from? Like how do we end up being like one side is dominant?
I don't know, actually.
Because like it's interesting, right? Because we're supposed to be symmetrical, very as you said, like right. So you get like the both like muscle tone on both sides. But then I guess you just become dominant on one side. It's interesting.
Yeah, I don't know. I don't know if it's like from your like neurologically, like with your brain, you can pick one side, or if it's genetic. I don't know the answer to that.
Interesting.
But yeah, that's a really cool thought. I'll look into it.
I'll look into it too. Yeah, if you find anything, let me know. Okay, so you have to be very symmetrical.
You have to be very symmetrical. But that was the same thing when I grew up. Like if being right-handed was like great. If you're left-handed, they kind of teach you how to be right-handed. But coming back to it, so that symmetry is very important within the first year of life, because to crawl, you have to be very symmetrical. To walk, you have to be very symmetrical. So your body does learn to like dissociate later, like where you're moving your trunk independently of your hip or one leg independently, but you have to do it symmetrically. So what I mean with that is like at 4 months, you might have seen like babies will start to bring up their knees. They'll do the happy baby pose where they grab onto their toes. So everything is very symmetrical. You're not dissociating, right? So you're moving your whole body together, hands to feet, and then you learn how to roll. But once you start rolling at like 5-6 months, now you're dissociating because you start by moving your hip. So you're not moving as a whole unit. You move one part of your body independently of the other part.
Very cool.
Right? Does that make sense? Yeah.
Yeah, it does make sense. Yeah.
So you dissociate, around that 5 months, and then 6 months is when your body starts rotating. That's where you develop like your obliques. That's when sitting is gonna come. So like after that, it's like you're rotating. You learn how to go from like sitting to your belly by rotating. So you're dissociating your body. So you still need to dissociate, but you have to do it symmetrically. So I have to do it over the right and the left side.
Makes sense.
So that's one thing I feel like a lot of parents don't realize with torticollis is that how it affects their milestones as well too. And then it affects so much more. Like torticollis affects your vision, like we talked about. These babies might think that this is their midline instead of this being their midline, because when you look straight, you realize what your midline is. But if I'm always looking at the world with the tilt, my midline is gonna be a little bit skewed.
Wow. I never even thought. So, you think it will affect your how peripheral vision develops on this side, for example?
I would think.
Right. So. If you always prefer it, it's kind of like going to be shorter, right? So.
Yeah.
And I guess this is going to be smaller. Wow.
Yeah. That's peripheral vision.
Very interesting.
Your vestibular system too, with the head tilt too. So all of that stuff. So like even babies who have torticollis, I recommend getting their vision assessed by a developmental optometrist. It's free within the first year of life. I think that's something that a lot of parents also don't know. You can go
Never heard about it, yeah.
You can go see an infant C provider, and within the first year of life, they'll do a developmental screen. So they'll look at the peripheral vision. They'll look at all of that stuff. And it's important for all babies, but especially with babies who have torticollis.
Wow.
So, yeah.
So it's free. It's covered by insurance, you mean?
Even if you don't have insurance, I think it's a free service. It's from an infant C, and I can give you a link.
Yeah, that'd be great. I put it in a bio. Yeah. Oh, wow.
I'm not associated with them, but it's a really good.
You should get a, what do they call it? Affiliate link? Yeah. Get a little discount or something.
It's a really cool program that I feel like parents can go check it out, and it's within the first year of life.
Is it just like a charity thing?
I think it might be government.
Wow.
I'm correct.
Sorry,
I think
you can move it to. Yeah.
It might be government based.
Wow. Yeah, never heard about it.
Yeah.
Wow. Okay. Interesting.
I think those are like the cool things with it. But early on, like babies don't have good head control within the first 3 years. I mean, first 3 months of life.
Very heavy.
Very
neck
heavy.
is not that strong yet.
They're learning about gravity. So I think it gets missed. The torticollis oftentimes gets missed unless the parent is working with a lactation consultant, a doula, a chiropractor, a pediatrician. So just watching out early on, like, hey, is my baby turning their head to both sides? Proactively making sure they turn their head to both sides. So that's where you can pick up if there is any like asymmetry, if there's any differences. And then again, like we talked about, that wellness screen would be so helpful, because then we can look at it. We can tell you like, hey, actually there is a difference. And if everything is great, then you come up with more resources and more knowledge how to help support your baby's development.
Yeah. I feel like it should be. And I remember we touched on it with that in Russia. We have I guess it's from a healthcare, a nurse comes into your house every day and she does like a little massage and make sure like it looks very rough. It looks very scary, but I guess they like check all the joints and like, so, I'm surprised here. I guess we don't have that. Obviously you go to a pediatrician, but do they check all this stuff? Do they?
Well, mine did.
Okay,
not
that's good.
in detail, but they'll look at the hips just to make sure there's no hip dysplasia early on. But they're looking at the whole body. There's so much that a pediatrician is screening. So I feel like they will sometimes pick on neck tightness and preference, but it also depends on the day you and your baby's having.
Yeah,
if they're pretty tense, they're pretty tired, like they're not spending an hour just looking at your whole baby's whole body. So if it's pretty apparent, if it's noticeable, if parents are noticing concerns, the the pediatrician would pick it up. And most of them do try to look at it. But I feel like you can look at those things and address it earlier by seeing a PT. Because it might not be as apparent from the neck, but you can look at their trunk. You can look at their hip, like you said. I'm looking at things, or PTs are looking at things that are more than just hip dysplasia. So we'll look at the whole trunk, their like legs, their toes. Is there any tightness on one hip more than the other? So yeah, they'll look at it, but not in as detail as you would as a PT.
Yeah, makes sense. I guess we can go to pediatricians more like a pathology level, right? It's like, oh, this is bad, you should fix that. Where with the PT, it's more like as you said, like as you I guess your practice called wellness. Yeah, that you actually look that everything functions properly.
Everything from functional. Like I'm not looking to see can your baby do tummy time. I'm looking at like what their movement and posture looks like in tummy time. So are they putting weight on both sides? Are they lifting their head as well as they're supposed to? Are they asymmetrical in tummy time? You know, and like, or are they just tensing their body to sustain their head to come up? So like really focusing on the movement and the quality of it. And I think that's more important. And that's where, well, like, it'd be good to see like, yeah, your baby can roll or your baby can crawl, but how are they doing it? What muscles are they using? What pattern are they using? Because that's really the key.
Amazing. So what do you think about those, timelines that usually people get, like, oh, this is like when your baby's, like, for example, this is when your baby's supposed to do this. Do you think it applies to every baby? Is that actually all those like development stages, they like actually happen on exact time, or there's a range that your baby can fall into?
I think there's a range. I feel like in textbook they'll teach you like this is a time, this is a time. And I think it's good to know the average, but then I like to give like a month or a couple of weeks on and off. So there's a range where it should happen. And then if it's not happening within that range, then I think it's a good time to kind of seek care. But also another thing to look at is like the continuum. Like, is my baby doing everything they're supposed to, but they're just a little bit behind? That's more important than my baby skipped a bunch of these milestones. And they're meeting what they're supposed to be at the end, but there's a reason why they skipped certain milestones. So like, if
all the parents who say like my baby skipped the crawl and just start walking, he's so cool, are wrong.
I mean, the baby's still cool, but I love crawling. I really do love crawling. Like, I would say so. Crawling, I know CDC removed it as a milestone, and they did.
Why?
And I think because not all babies crawled, so because of that, they removed it as a milestone. They didn't think it was a relevant milestone anymore, and they have changed the timeline for a lot of milestones.
Was that recent?
I think 2 years ago, maybe a year or 2 years ago. But I feel like it's because a lot of babies weren't meeting things when they were supposed to. So we have changed the criteria and shifted it to later, versus looking at like why aren't they meeting their milestones? What has changed?
What do you think about that?
I think it could be multiple things. It could be just the lifestyle in general, but it could just be like babies not getting a lot of like free movement, free play like they're supposed to. It could be like not seeking help early on if you are noticing anything. And there's a lot more like containers out too. So like if babies are in like bouncers, swings, extra saucers for multiple times during the day, not if you use it here and there, but they're in it majority of the time, that can impact their development. Because all of us like feel good when we move freely, when we can move however we're supposed to. So I feel like technology is there to help us too, but I think we need to like learn how to use it moderately. Yeah. So I feel like that could have impacted. Maybe
I could totally see that.
Yeah. I don't know if COVID had anything to do with it or not. Not like
because parents will spend more time with their kids at home. Just like be in a swing the whole time.
I mean, we don't have good resources for them to work and have like, you know, like childcare is so like undervalued in this country. But maybe, like if you were supposed to be working and taking care of your child and running the household, that it could have been a lot, you know? And then you had to do what you had to do, but that could impact the baby's development too.
Because I see a lot of parents, just like in my friends' houses and stuff, they put their baby in that thing, you know, like does this. And they just lay there. And they usually always kind of like on their side and their head is like turned. And they're there like for hours. I'm like, I don't think that's like good.
Yeah, it's not. Yeah, it's one of those things. I feel like those products are marketed and they're sold really well, but they're not really good from a baby's development standpoint.
Yeah.
You do have to use them as parents, and I only had experience with one. So I feel like if you have multiple kids, then you might rely on them a little bit more. But I think the key is like making sure the baby's getting free movement.
Yeah.
And they're not in it for hours. Like you
Yeah.
said, if they're only looking at one side, they are gonna have like flatness. They're only on the back of their head. Maybe because of that too, they might not be able to like learn how to move their muscles like they're supposed to on the floor. And they're feeling gravity, like they won't feel the effect of gravity. They're in the supported caudal position. It could be helpful like on times when you need to do something, when you need to go take a shower, put your baby in a safe place. Like I say like 30, 40 minutes max, and then do a lot of floor time afterwards. I love baby wearing. If you're able to, like, baby wearing is really great. It gives you like free hands, you know, your baby also feels a lot of like input and movement through that, which is very helpful because you're moving, your baby's getting a lot of vestibular input, proprioception input as you're going up, bending down, squatting, moving throughout the house. And babies overall really like it. There's some babies who don't like it. And I feel like sometimes they do have like either they're wigglers, like they want to be out and exploring, or there might be tension in their body where they don't feel comfortable get in that carrier. Like some babies who are really tense can't like bend and like adduct their hips really wide to sit in a carrier early on.
Never thought of that.
So they don't feel really comfortable in it.
Oh, so now they're not just being difficult. They actually
have a hard time in it. There's the other babies who want to be moving. So then those are different. Then you can create like a play environment for them that's safe, that you can put them in and they can explore. But they also don't like the carrier, but that's because they're so mobile. And they're really exploring. And other than that, like developmentally at one point, babies would want to be out anyway of the carrier. But I love that over those like containers, swings, jumper, and all those devices. But yeah.
What do you think about those, where you put the baby and it's like a circle?
The walker, the extra saucer.
I guess. And they just like kind of speed around the room and stuff. But I feel like their legs are barely touching, so they kind of do this instead of feeling the ground with their feet. What are your thoughts on that?
I don't like them as a physical therapist.
Yeah.
My family told me to get it multiple times for my kids, and I was like, nope, there's no way I'm putting
Your family
my baby.
told you?
Yeah.
Why?
I was like, you know what I do for a living? I'm not putting my baby in an extra saucer. I think there's this like thinking that it's going to help with development. And I think a lot of people get it thinking, oh, it's going to help your baby walk. It's going to help give your baby independence.
I didn't know that's how it's promoted.
That's how it was promoted. And that's what my family's rationale was like we put you in it, like it helped you walk. It's going to make sure you walk early. You're going to be able to go to places like, so it doesn't help with development. Like you mentioned, they're not putting weight properly on their feet like they're supposed to. They're just kind of like hanging in this thing. So they're not using their core. You need your core to take those independent steps. And then sometimes if your house is not proofed properly, it could also lead to accidents.
Like they fall over,
trip over something, stairs, just, like different surfaces. I'm sure a lot of parents have it, but it does cause accidents. I think it's banned in Canada because it can affect babies' development.
Wow.
The extra saucers, like, I think it's marketed as like it's going to help with development, but it really doesn't. You can't use your core. You're improperly weight bearing. It affects your hips alignment. And yes, the baby has independence, but it's not like a true independence as them like moving. So I would rather have babies crawl wherever they need to, versus like being in those devices and move around. Babies love it. They can go to places with a minimal effort. They're very active at that age. They want to see what mom is doing, dad is doing, chasing the dog, but it's not that great for them.
Yeah, I guess crawling would be, a better way. I mean, I don't know why the CDC excluded, as you said, because I feel like crawling develops those muscles that we as adults, we need to crawl as adults. Yeah. Like, that's what I truly believe. Like, you need to crawl and, like, just, like, kind of use, like, the hip mobility. All of us, because of sitting, just, like, hips are just crunch like this. Yeah, it's so bad.
Crawling helps with, like, depth perception, going over different surfaces. Bilateral coordination is the only time, like you said, you're weight bearing on your hands.
That too, yeah.
Right? So it works a lot on your shoulder.
Yeah.
A lot of shoulder strength.
Scapular movement.
Later with kids, it helps with like fine motor stuff.
Really?
So yeah, because if your shoulder has to be strong for you to like learn how to move your fine motor movement. So that's why like in development, babies' big muscles develop. So your gross motor comes before your fine motor. So
Makes sense, yeah.
Yeah. So like that's why pincer grasp comes later at like 9 months. But up until then, like you're working a lot on your tummy time, working on the shoulder muscles, working on pushing up on your hands and knees. And now your shoulder is nice and stable. You can work on that pincer grasp, which is like a fine movement. So for kids older, it's like cutting things, writing, handwriting, drawing, all of that, like picking up beads, like anything fine motor, crawling helped those babies out because they really have strong shoulder muscles with that too. Yeah, like
we should file a petition or something.
But crawling back,
put it back in.
Crawling matters.
Crawling matters. I remember my mom always said that my younger sister, she preferred crawling though. She like did not want to walk because she was so fast.
Yeah.
She's like, walking is slow. I'm not doing that. I need to get places. She's like,
And you see these babies are crawling, like crawl so fast over different surfaces. And I would rather have a baby who crawled and walked a little bit later than a baby who skipped crawling. It's so important, I feel like, as a PT from a developmental standpoint.
Yeah, for sure. Yeah. And I feel like it's kind of cool that if they are crawling, they then they're like, I need to get places higher, and they like learn standing, right? And that's how you kind of get into walking. You're like, oh, I can actually use these two.
Yeah.
And yeah.
Which is right, because then those shoulder muscles will help you to pull up to stand. And now you're standing.
That's a good point.
You develop all the way down. Because babies can pull up to stand. So there's 2 ways you pull up to stand. One is by going forward.
Okay.
One is by going sideways. So now you're rotating. You're using your core a little bit more. You're pulling onto the surface. And then you're pulling yourself up to stand. And you do it. One is by non-dissociation. So you use both of your toes to push up. The other one is by you get in a half kneel. And then you pull up.
So more like an old person pull. You're like when like something hurts and you're like, oh. Like
knee.
I started doing that after I turned 33. I'm like, okay, yeah, I would do it sideways now. Okay, so but both are good for babies. Like babies need to learn both, or the side one is a little.
The side one is a little better.
Oh, it's better.
It's better because you're rotating. You're using your obliques.
I thought the straight one would be better.
The straight one is you're using all of your body together. So just like with rolling, when you learn to roll, you're going to roll together as one unit. And then once you have learned it, then you dissociate and you lead with your hip. Same thing with pulling up to stand. When you're first learning how to pull up to stand, you'll put your hands and it's a lot of that pull up and you push through your toes. But then later, once you have done it and you've mastered, you're rotating, you're bringing one hip forward. So a lot of weight on that one hip for strengthening. And you push up almost like a half kneel to stand, which requires a lot of that hip strength, a lot of weight bearing on your one leg and your arm to kind of work together and your core. So that one is better when
so just
elevated
version.
Exactly.
Got it.
Yeah.
Interesting. Okay. Amazing. So, and I remember, okay, awesome. So we got that. I'm like, we talked about having kids next year. So now I'm like, I need to know everything. Okay. So, and I remember we touched on when you and I met a little bit about sitting. You had a lot of thoughts on that.
Yeah.
Remind me. You remember you had like a client we spoke about because I'm Russian. You said like I have Russian client and something with the sitting.
Yeah, I remember. So I think we were talking about a lot of my Russian parents. I think it's a cultural belief that you want your baby to sit at 6 months. I think that's what we're talking about.
Is that considered a milestone in CDC? According to CDC.
6 month. So I think CDC might have done like 7 or 8 for sitting. Where I like to see our baby sitting by 6 months. 6.5 months. You're not stable, but you're just sitting a little bit because around that time you're getting ready to eat solids. And you need your core and your trunk control to be in a proper posture to eat. So with speech therapists that I work with, like they also agree, like you need your head control. You need to make sure your head is up and you're not kind of like down when you're sitting for like a proper airway and feeding, swallowing. Your trunk has to be supported and strong enough to sit in a high chair. So you're not leaning, you're not slumping. Also like bringing food to your mouth and interest in food. So those are the 4 things. But from a PT perspective, having that a little bit of your trunk control, which comes after your head control. So your head control
makes sense. Okay,
will come by 3 months, 3.5 months. Then for afterwards, like up until 6.5 months, you should have your trunk control. Babies should, even 7 is okay. And then later, then your baby will develop with hip, ankle, all the way down. So you develop head down.
Oh, you are?
Developmentally.
I thought hips kind of developed before the core, I guess.
So like I think hip or your pelvic control comes after sitting.
After sitting.
Because that's when you're really exploring like hands and knees, crawling, kneeling position, half kneeling. Then you stand up. So you have pelvis hip control. And then you have your ankle control when you are moving.
Interesting. Okay.
So developmentally, like that's how it would kind of come. So I like to see babies sitting before they're doing solids. But what we were talking about, like some of the, like different cultural preferences and cultures. Where a lot of my Russian parents, like their grandparents, they want their kids to sit at 6 months because I think there is something about with spine development, and I don't know enough about it, but they would put your babies in sitting at 6 months or when babies can come to sitting by themselves. And so what
they put you in sitting. Is that
at 6
bad,
months?
Though?
It's not bad. I think it just depends on your baby's movement. So like I like to start babies in sitting at 4.5, 5 months.
Okay.
In a prop sitting position. So you're really supporting them. Their hands are on the floor with their knees wide. And then from there, they learn how to bring their hands to their knees and then their hands in this high guard position and then in this position where they're holding onto the ball. And we were talking about like how different culturally, like with those babies, what I see is like their babies will crawl before they would sit.
Oh, yeah, that's right. I remember
that's what
you
we were
said
talking
that.
about,
Yeah.
which was really cool because then those babies are exploring a lot on their tummy.
But isn't it mean that their hips develop before their trunk, though?
So
if
they're
crawling before they're sitting?
So they're crawling on their belly.
They're crawling on their belly? Oh, like
Army crawling.
Army crawling.
Army crawling. And then they'll learn how to sit, and then they'll come to like hands and knees crawling a little bit later. So they are using their hip flexor muscles, but they are just using them in an army crawling position. But they're using a lot of their shoulder, their back
pull.
extensor muscles to pull forward. And once those babies are sitting, that's when they learn how to like rotate and get on hands and knees. So I feel like there's not a right or wrong way, but it was like a very like culturally how things are done differently is what we were chatting about. Because here, what I see with most of the babies is like we'll work on sitting and then those babies are sitting. And then after that, they'll learn how to go from sitting to belly and then army crawling. Like it'll kind of develop around the same time. Versus in like a lot of like Russian community, I see those babies will crawl and then they'll come to sitting. 2 different skills. One is static. One is very like transitional. One is very mobile. So yeah.
Very cool. Do you have a lot of clients from different cultures? Have you seen any more cultural differences in how they approach baby's development?
I think that's one of them. A lot of like South Asian people, I feel like will really do massage and baby massages, which is really cool because it's like a bonding, and then they're like already into like relaxing the baby, working on like, because they'll ask me like, how can we massage better? And how can, like what is targeted massage, which is really cool. And those parents have like grandparents with them or who are visiting, so they'll do a lot of that stuff. So that's one thing. I think something I see a lot in like certain cultures is like, or even in maybe in American cultures, like having babies with like socks are fully covered when they're playing. That's one thing. Like your babies have to have socks on them or have to have their feet covered. Have to, like, you feel like babies are so fragile. Like if they are.
Oh, you mean like people usually do it, but you shouldn't?
Not that you shouldn't, but I think like realizing that when they're playing and when they're moving, less is more too. So like if they are doing tummy time, like doing it without socks, without those pajamas where their feet are covered, or even doing it in the onesie or just in the diaper is good because you're getting so much input from the ground. Like my parents always gave me a hard time because my baby never wore socks. They're like, your baby's gonna be cold, like put on a socks.
Why did you buy all of these?
Put on like baby mitts, and you need it when it's cold, but in your house it's temperature controlled environment, so you can be in a way where your baby can like explore because they're really touching the floor with their toes, with their hands. Like the other thing I see is like the baby mitts. that goes on their hands.
Okay.
So it kind of prevents them from like feeling their fingers to their mouth or their hands to their mouth. and
Wait, they
exploring.
put them just so like that
They're
don't
not
scratch
scratching themselves.
Oh, yeah. I've
Like,
seen those to put in sleep. I didn't know they could wear them throughout the day.
some people do. So I just kind of like tell them like, hey, I think we always take them out for therapy.
Yeah.
And I encourage like, even if you don't want to do it all day, because that's your parenting style, which is great. But maybe during some movement, some playtime, or at least one of them, let them explore. Because once you feel, that's when your muscles want to move. You get your sensory input first, and then you move with your motor output.
Sure.
So taking those socks off, working without pajamas, or even playing in a diaper once a day or so, it's going to be so helpful for your baby. But that's something I see like culturally, like a lot of like some of my Hispanic families, South Asian, even myself included, like my parents are like, babies need to have socks. Like they're going to be so cold. And I'm like, it's fine. We live in Texas. Like we're not outdoors.
I'm curious, like where that belief came from. Like in Russia, they always bundle up too. My mom was like, "Don't touch her. Like she's fine." And maybe that's why I hate shoes and just like walk barefoot everywhere. Yeah. But she did something wrong. Like I hate when things are on me. Like my goal is to live naked somewhere in the woods. But anyway, yeah. But maybe because just babies are small and you kind of like they're gonna be cold, but they usually run a little hotter, right? The body temperature is a little like they're warmer than adults. I believe.
Think so.
So I don't think. Plus, they're moving so much compared to us. I'm sure they're fine.
And I feel like I don't know the exact age, but after a little bit, like when they're not a newborn anymore, they are able to regulate their temperature a lot better. So I feel like because like early on, they're like relying on you. You're doing a lot of skin to skin for like temperature regulation and everything too. But after 3 months, like they have good head control. They're moving a lot and they are more active and awake. So even if you don't want to do it early on, I feel like from my personally, it's like when you see them early on, you're like, the baby's a little, they can't control their temperature. Let's bundle them up, like warmer the better. But after 3 months, like you should be able to like at least one playtime would be helpful, because you'll notice those babies will start to like explore and move a lot better. They're like, oh, I can push from my toe. I'm feeling that, oh, like this is what the rug feels like or the rag feels like on my hand. It's not hands as much. It's mainly the toes that I see.
Yeah.
So I always just remove the socks wherever I
I
go.
think the socks also, like if you're trying to do some movements, like you're gonna slip. Like a lot of people have like hardwood floors, right? So I mean, even in the carpet, you might slip. So I feel like you just don't learn that. Even like you always talk with my clients, a lot of adults, because of I guess our shoes are like this, they don't know how to use their toes and like grab the ground, like do like a suction cup. And like I feel like babies is what they learn. They're like, oh, this is how I engage with the floor. With
I
my
agree.
Foot.
Yeah. Like when they are learning how to stand, when they're kneeling, when they're rolling, they'll get some input. And then also with crawling, the surface matters too. So like up until they learn it, because if you're crawling with your pajamas on a hardwood floor, your knees might slide. Carpet might give you a little bit more traction, or no pajama would too. So that's something that I look at as well too. And then tell parents like, try different surfaces. I think variety is the key.
Yeah. Just like grass, stone, everything. Well, I know like there's an interesting book my friend told me about. I've yet to read it, but I talked about how babies grow up like like very deep somewhere in Africa, like not in a city, but like actually in forget what you call it, pleme, like a communal.
Okay.
What do you call it?
Village,
no? I guess. Yeah,
or
sure.
something.
Let's do that.
Okay, maybe
I couldn't remember the translation of the word, but anyway, and they let babies, because they have a lot of kids, and they just let them run. So they like run, and they're like sharp things and stuff, but you don't watch over the kid. You're like, oh, don't touch that. They just like explore. And as the writer said, like she was shocked that nothing happens to the babies. Like they're fine. Because I guess they learn like, oh, this is sharp, I shouldn't like lay on it. Or like they crawl everywhere, and she was just like, it's so different from how we think of kids and their babies do, because we always like, I should like watch over so they don't drink bleach, or like don't drop this on themselves. But somehow like if you kind of give them a little more freedom, they're fine. Most of the time. Obviously I'm sure there are like things can happen, but do you think that the parenting style should be a little more kind of freeing for the baby, or should, it's a hard question, I know, because you're as a mom too, you're probably like, okay, I need to make sure baby's okay, because you obviously took a long time to get him here?
Yeah. I think it depends on your parenting style. But one thing I would say, like the idea that I would take from that is going to be like, safeguard your house from what you can, but then give, like, obviously, like if there's stairs and your baby doesn't know how to do it, like what, like to safeguard. But then let your baby explore and move. So like you want to do what I told my nanny when I was out. It's like, you want to be with your baby and I want you to do purposeful play activities with him. But I also want you to put him down and see what he does and what he wants to do and how he wants to explore his body and movement. So that's going to be the key. Like once he's there, like let him roam around the house, like watch him. You don't have to be with him one-on-one. Like you can supervise him.
Yeah.
But if it's safe, like let him explore that area, see what does he crawl up to, what does he discover, how is he playing with this toy. So I think that's what I would kind of get out from that idea. I had to learn to let go of control. It's hard.
I feel like that would be me. Yeah, I'm just like, because I look in how I control the dog. I'm like, don't do this, don't do this. In my mom's house was like, you have to like let go. Yeah. Your kid's gonna be miserable. Damn. What was the hardest part for you of like letting go of the kind of supervision, I guess?
I think for me the hardest part was like letting go in terms of like early intervention. So we talked a little bit about my journey. Like it took a really long time to have my son, and we did it with IVF. And so a lot of things were out of my control. So once I think I got pregnant, I became a mom, I tried to seek more control. And it's something I'm working with a therapist. But the hardest thing I had was like letting go of his movement and like learning that early intervention is so important, but then also like giving him time to see where he develops and how his body moves. Like movement wise, it wasn't that bad. Like I already set up the play area for safe place for him. We use very minimal containers at our house. Like we don't have anything. And
what's containers you mean?
Sorry, the bouncers, the extra saucers.
You call it container?
They're called containers because it's used to like
contain the baby. Nice. Containers. Okay, cool.
I mean, but those are also your Tupperware. So a good question.
Like it's a bilingual. I'm like, wait, what? Containers?
Like the food containers?
The crates for the, okay.
For the baby.
Okay, so less containers,
less containers, but I already had that like environment set up for him. So it wasn't like how he kind of played, but I think just trying to control his well-being was hard for me to let go control-wise, But I noticed that when I did and I tried to like engage more just like playfully and didn't work, like beautiful thing happens. Like, like he would communicate, he would like flourish, like, and like trying to discovering his personality. So I think balance is a key. Like you just need to know, but in terms of like movement, I think less is more. Letting them explore, like, if there's a cushion on the floor, before you remove it, let's see what your baby does. Can they crawl over it? Can they walk over it? Like watch it with supervision, you know? And sometimes I'm like, once they're doing things, make it an obstacle course for them. Because they're going to have to learn how to go and problem solve. Fun. Yeah.
You just like do obstacles and then you watch.
You do it. That's what my work is like.
I love it. Is that how the sessions how do sessions usually look like when people come into you? Like what does it look like?
It's very play based. So I am mainly like facilitating the baby through different movement. For younger babies, it's a lot different. It's a lot more like calming and play in a different manner. So like we're working on stretching. We're doing a lot of like regulating on the ball. And for them, play early on is going to be like anything like tracking, black and white, talking to these babies. But like 4 months and up, it's like a lot of rolling, a lot of like crawling, a lot of crawling over different surfaces. So kind of like teaching them how to do that in a playful manner, whether it's toys, whether it's them engaging with their parents. And I'm just facilitating them from the back. So it feels like fun. It's like playing with them all day long, but it's like in a therapeutic manner. And the other best part about working with babies is that you work with moms and dads. And I think working with
Is it the best part? I feel like usually people say it's the opposite.
No, I love it. I love it. I'm a talker and I'm a very social person. So just if they open up, just talking to them, it's really great. Like I think it makes the session go by really fast. We get to learn each other. And I think after being a mom, like I can relate to them a lot more too. Yeah. Versus before, like I'm like, but now I've experienced a lot of things.
I'm waiting for that.
But it's a lot of fun. And then like babies just bring so much happiness to me, like when I work with them. So
It's amazing.
I don't think I can do anything else. I love it.
How did you... So that reminds me. Oh, I'm too low? It was so comfortable.
I had to remind myself to sit up.
I'm like, real. I was like, I'm so comfortable. That's the whole point when we're talking like need movement. When you like, I wish I could just do it. You know, like on. Maybe I should do that. Like podcast on the floor so I can move differently.
I'd be down to. I sit on the floor all the time.
Same.
All the time.
Love it.
Even if there's a party and there's no chair, I'm like, floor is good enough.
I know. People always like, do you need a chair? I'm like, I hate the chair. I want to sit on the floor. Yeah, I'll think about it. Yeah, podcast on the floor. That would be interesting. I feel like some guests would not be up for it, though.
You pull out your beautiful chairs. But you can just put a cushion and you guys can just sit comfortably and move.
Yeah. Ideal is like, you know, like that Middle Eastern style, just like pillows if you need.
Yeah, that's what I was thinking.
Yeah, that's perfect.
Yeah, just something to put your glass on.
Yeah.
And this, but I wouldn't have minded it.
It's a great idea. We'll do it when I do it. When I switch it up in a year, we'll do that. I wanted to ask you, how did you get into the field? I don't remember if I asked you when we had a lunch, but yeah.
Ever since I was little, like I always knew I wanted to do something where I could help people. Mm-hmm. So that was something I always wanted to do. And I wasn't sure what I wanted to do in medical field. Mm-hmm. So I explored different like professions in like university when I was getting time to kind of think about it. So I wanted one where I'm helping people, but then other when I can form these long-term relationships. And I feel like, because you help people as in different fields and a lot of medical providers do, but then I wanted something where I can see them through and have that long-term relationship. So when I shadowed a physical therapist who worked in pediatrics, like it was just so fun. Like I was like, this is it. This is what I want to do. Like it's very functional, very play-based, very fun. And you are working, but it's just, it brings you so much happiness working with babies and kids. So I was like, okay, you know what? I want to be a PT. And my parents still make fun of me because next day I'm like, I'm going to be a PT. They're like, you just woke up and you're like, I want to be a PT. And I was like, yep, this is what I want to do. I just knew it. So I think that's what kind of got me into it. And I feel like being a pediatric PT or working in an outpatient clinic that I do, it kind of checks all of those things. Like I see kids, I'm able to like make differences in their life. I see parents and I see like their relationship change with their babies, their anxiety decreases when they do like resolve whatever they're working on. But then like also like being there for parents. And like I think that talking early on postpartum is like so good for like emotional support, social support, and
100%.
Seeing these babies sometimes weeks, sometimes a year. I see how much they've grown and I just really love it. I think they become part of my family. Like some of us like got to coffee once they're discharged. Like these moms honestly that I met looked after me after postpartum. Like they checked up on me like, hey, how are you doing? Do you need to go for a walk? And it was just so special. At my son's birthday, like half of my friends were like my old patients who retired. And, now they see me in this life and it was just wonderful.
I just love when humans are cute.
Yeah, it's just a little community. And I feel like being able to do that.
Yeah.
Like, they're just so appreciative, like especially early on. And that's why I love working with babies because babies are vulnerable, but I think so are parents early years. And just being able to provide them with so much support and knowledge, just anything that I can do to help decrease their anxiety is just what makes it worth it for me.
100%.
Yeah.
Oh, I love it. I mean, it's amazing, especially like I feel like women postpartum, like the first, their first checkup is like 6 weeks postpartum. Right, and then I feel like you don't get that much, unless you have like a women's circle, but you don't get that much, I guess maybe thankful ears even. I feel like sometimes they just need to talk. A lot of my postpartum, they just like, they want to tell like their birth story, but no one probably from their life wants to hear it because like, oh, I wasn't paying for like 10 hours, like, okay. Right, and then like they tell me like every detail and I ask them and they're like, how's the like your relationship with the baby, like is he responding, like, and they're like so excited. So I feel like if that probably could like just a huge benefit they see from relationship with you, just not even like taking care of like baby's development, but actually having that connection, which is amazing.
Like some of them are like, I got out of the house by myself for the first time today without my partner. And I'm like, yay, you did it. Like, God. This is really great. Like, they're like, I'm running late. I'm like, it doesn't matter. You did this trip by yourself because those are a lot. Like, and I think again, like experiencing it, I get it, like, you know, or like seeing like how overwhelming it can be if you're not seeking a support from a wellness perspective.
Yeah.
Because as a new parent, like sometimes you just worry and you want to make sure everything is okay. And I was there myself. So being able to give back to them and like help decrease their anxiety at any level, it just,
Yeah.
a lot to me.
Especially with the amount of stuff you see online too.
Oh, yeah.
Yeah.
Like the worst.
Yeah. I don't know. I mean, even like within the pregnancy field too, like I see so many conflicting most of the time too informations about how you should give birth, for example. You're like, oh my God, women are probably like going insane if you like do not know where to look for information.
That was me.
Yeah.
I think when I became pregnant, like there was so much out there, like medicated, unmedicated. Even if you're making a registry, there's so many products out there. It's so overwhelming.
Yeah.
And I think if you don't have a community or someone you can like trust or rely on, then you never know what to do.
Yeah.
And that's the same thing with babies, like baby products, baby-led weaning, purees. Like there's so much information.
Yeah.
Which is good. It's raising awareness, but it's also like very confusing. It can make you more overwhelmed. And then, like you said, then you end up just saving it and not doing anything because you're in that state. So
yeah, for sure. I mean, even like I think about like having a baby. I'm like, and my husband's like, we have to buy so much stuff. Like I need to make twice as more money. I'm like, I don't know if you like should. I feel like a lot of those things that obviously make your life so much easier, but a lot of those also very marketing.
Yeah.
Right. So I feel like your baby needs you most of the time.
I
Like
agree.
that's the most important part of their life.
I agree with you. And I think that's one thing that wasn't as apparent to me when I became a mom. Because like I told you, I was so focused on multiple things and my baby and I always had a really good connection and I'm so grateful for that. But I took it for granted. Like, because it felt so easy. We were so connected and I was so in tune with him and he was in tune to me. So it wasn't one of the things that bond was like on my checklist or anything, you know, because it was so natural. But I think like now going back, like my first advice or anything to parents is that the bonding and that connection, like all your baby needs is you.
Yeah.
Like that's all they need. And less is more is the second thing that I'm learning because I bought so many toys, so many outfits. Like I had like one pack of like burp cloths and my sister was like, that's not enough. You need 2 more. And now we have like so many burp cloths. And I'm like,
God.
Really, less would have been more.
All you need is more hands, I believe. I feel like
I
that's,
agree. That is
I feel like that's
what
like
you
a
need.
big downside since I moved to America. I noticed because I've always been in the field of like postpartum and pregnancy.
Yeah.
Especially in New York, it was more noticeable than here. But a lot of parents do not have their parents around.
Yeah.
Like in Russia, it's very communal. You have bunch of your relatives coming to your house when you need them to help you, like, oh, I'll hold the baby while you shower, right? And like I'll play with him while you do this. So there's a lot of human contact, even though it's not with you, but still human contact. Like, you know, they play with the babies. Here, you most of the time you're like alone, or you hire someone to help you. But from what I've seen, not all babysitters is what we call them. Babysitters attentive. They're mostly on their phone while baby's doing their own thing. So the baby's kind of alone.
Yeah.
So I feel like you definitely need more communal. So maybe like organizing like other moms and just doing like the play dates and stuff is more beneficial than buying a fancy gadget.
I agree. Like I think support and that education, like getting mom groups, looking into doulas, like I think now there's a trend. I see it more now, like investing more in like your mental health and what's better for your baby's well-being versus like equipment. Like I think it's fun to shop. It's always fun to shop and buy things, come with boxes. But at the end, I feel like that's would have been like more. And also you're getting to know your baby.
Yeah.
So once you have your baby, that's when you'll have an idea like, hey, I think my baby likes this and not this. So then let me get that. Like we invested in a car seat and a stroller, but my baby is a total baby wearing baby. We're never like taking that car seat or stroller on walk. I'm like always wearing him. It just sits in the house. And I'm like, you know, like I think that would have been a good idea to see what kind of baby I end up having. You need a car seat, obviously, but maybe like see and then get a stroller or get a stroller, but then just like, you know, invest in multiple option or same thing with the containers or toys. But yeah, I think like support, looking into support and the community is so big because it feels very isolating. And even if you do have the community, sometimes when you become a mom, your values don't align with that community either. It could happen. It can like, it can challenge your values. You might be a different person. you resonate with one thing more. So like ways you can talk to someone, form a new community alongside with that too is super helpful. Whether it's doulas, investing in massage therapy, and your own like wellness and health is going to be important, pelvic floor PT, and then infant therapy, and all like chiropractic visits, like all of those are important. I think we should maybe look into investing in those.
I 100% agree. Yeah, I feel like scratch the healthcare system. Redo. Yeah. Okay, amazing. So, yeah, I don't know. What else do we want to touch up on? I feel like so much information. What do you want to say anything? Kind of closing statements?
I feel like one of the biggest thing we touched at the end, like in terms of like baby's development, like the biggest thing they need is their parent or their like caregiver in life that they can bond with, like mom, dad. And community is going to be really big. But with babies, like what's really important for the development is like that free play, free movement. Variety is going to be key with anything. So giving them variety of positions, variety of like surfaces. Less is more, like being more creative with your toys and like talking to them, singing to them, like using books as activities early on. Something to look at them would be helpful. But then like knowing their support. There's people like me who can help you, give you more tools to kind of like empower you and support your baby's development. And there's nothing wrong with it. You're being more proactive and you're helping your baby.
Yeah.
And if there is anything, you're helping them like overcome those obstacles a lot better. So like looking at us as support, kind of like you would look at containers or all this other stuff in the time of need. That's what we are for your baby, and kind of help them. And it is important. So yeah.
How would you say people like who are like not in Austin, for example, can they find support like you in other places? Like what should they look for?
So I would look into like any pediatric or physical therapist within their area. Like you mean in terms of like PT or someone that does what I do?
Like,
or
I mean, even like having your like how to find a person who has your approach to it, like seeing it more as a wellness rather than a pathology. For example, like you know, a new parent comes in with the baby to baby PT, and there's like, well, there's nothing wrong with your baby. Like, what you came here for? You know what I mean?
True.
Yeah.
I think the biggest thing is like a lot of maybe just calling and inquiring about it before and making sure what their mindset is. A lot of people would have it on their like their websites and stuff, and they'll talk about if they are very like wellness based or not, and what they look into. Seeking providers who do virtual visits like we do too would be another option.
You do virtual visits?
I do virtual. So we do virtual, at home, and clinic visits. Not as many, like few people do virtual. I think a lot of people prefer to go in person, but that's an option. But I think...
how would the virtual look like? You just like tell the parent like what to do?
So we would do it over like a Zoom. And we'll do it with your baby together. So I would have like my mock baby doll, and then you'll have the other one will tell you like how to play with your baby, how to like what are some age appropriate things you can do, how to handle the baby. Because I got really good at it during the COVID.
Oh, I didn't even think about it. So you were doing that during COVID?
I lived in San Francisco at that time, and everything was shut off for like 4 months. So we did virtual therapy. At first, I wasn't as receptive, but I noticed that it kind of made me a better communicator, and parents felt more empowered because they were the one doing these things by themselves. Like, it's great to have someone to show you things too. Like, that's the person I am. Like, I would want you to show me. That's how I learned the best. But at that time, those parents learned how to move their baby by themselves. So if there was any fear or anything, like, they were the one handling. So they kind of overcame that. Yeah. Which was good to see. And then also some people might have baby courses too, which is one thing we don't have right now. We're looking into it. But there might be like courses on like rolling and stuff so that you can look into to kind of help support your baby's development if you are in a different part of the world.
When is your project coming?
Hopefully end of this year is my goal.
Amazing.
Or next year, yeah.
Okay, amazing.
Things get pushed a little bit more, but yes, yeah, hopefully. I'd love to know more from you about it.
About what? Oh, baby massage?
Baby massage and like just even like how to get started.
I have no idea. I feel like you just I don't know how we do it all. We just one thing at a time, you know. Yeah. Like with everything, you just do one thing at a time. And I'm not a mom yet, so I have more time than you. Just like trying to.
You're a dog and a cat mom.
No, I don't know. I don't think that counts. It's not the same. We didn't go through I mean, I guess we did go through development stages, but it was more about training than anything else. I don't think that approach would work with babies. I always like think that, you know, you can't train the baby. You have to like cooperate with them rather than I tell you this and you do this.
Yeah. You have to get to know them and then see how you can get them to do what you want them to do.
Yeah, it's a lot of kind of like team building rather than...
Yeah, it is right. It is a team.
Yeah.
That's why they call it co-regulation in a diet. Like you and your baby are a team, right? Like I think that's the best way to put at it.
I like that.
You and your baby is your team.
Yeah.
Because they really do respond when we go with that mindset. Yeah.
Yeah, I mean, I know with like older kids too, like you can't really push them because it's a whole nother human being with their whole set of like how they see the world, right? So you can't really like kind of suppress them. You have to work with them. But I guess it starts like very early on, right? Like, oh, I don't like doing this, so I'm not going to do this. You can't force them, but yeah.
True. Very early on. And then I think sometimes there are reasons why babies don't like it. So like, just going back to it, like I think 0 to 1, something I hear is like my baby's just being lazy, my baby's just being tired, or they don't want to do it.
Yeah.
But there's always a reason why.
Yeah.
And I think oftentimes it's hard, it's challenging, they're feeling weak, they need more support. Later on, when a lot of behavioral and emotional stuff come, then it's different.
Do you think, you just said that, and I remember the high chair, for example, I know some babies like hate sitting in it. Do you think it's because like the sitting's like not comfortable for them, for example?
So, yes, and more. My baby hates sitting in high chair. So
he's just like, I want to explore.
He wants to explore. He's a very high energy.
He's like you. He wants to be on the floor.
He wants to be exactly like he wants to be on the floor eating. He wants to crawl and eat his food. And I'm like, dude, this does not sound sanitary. I just have a hard time. You're just moving your bread all around. But I think it could come from multiple things. So like one, they might like need more regulation. In terms of me, like I think my infant, like my baby, needs a little more regulation to feel calm in the chair. Maybe high chair might not be the best setup for him. Maybe floor would be, or something else would be.
Yeah.
And then maybe it is hard, like body wise, for him to like use those muscles a long time to sit still, because he's constantly moving.
Yeah.
He's constantly moving his body through multiple stages, but then to like really stay in an active state where he's static is hard.
Yeah.
And then the other thing could be like behavior and cognitive, like either he's bored, he's distracted, there's so much things going on, he wants to go explore.
Well, there are adults like that too.
Yeah.
For sure.
So there's multiple things than just one, but that's where it would kind of come in like, hey, is this the body? Does he need more sensory regulation? Is he just that as a baby? Like he just wants to move, explore. Maybe he's not hungry at this time, or, just trying to figure it out.
Yeah.
Yeah. Versus one. But it's hard. It makes meal times in restaurants really hard for us.
I bet you could just like sit next to you. Maybe that would be more doable.
Wants to stand on me and eat his food. Yes. Or if it's a booth, just like cruise back and forth, eat and go. Like he's such an explorer.
Yeah.
But
I don't know if I'm ready. But anyway, we'll get there. Well, it's amazing. Thank you so much for, I guess we have to wrap up. Thank you so much for coming. It was so insightful. I enjoyed talking to you once again. I think it went this time even better because it's longer, obviously. But yeah, thank you so much. I'm gonna link all your stuff below so people can follow you on Instagram. And do you have any other platform? Do you do any other
mainly
YouTubes
Instagram is the big one.
Yeah, and they can contact you. You have office in Round Rock? No,
close Westlake Hills.
Westlake
I have
Hills,
an office,
that's right.
And then I'll do home visits all throughout Austin.
Exactly.
And then I'll send you the resources for infancy.
Amazing. Well, thank you so much. Thank you guys for watching. Please follow our beautiful guests on all the things I link below.
Thank you.
Thank you, Amreen.
Thank you for having me.
Thank you.